And Simone's a PhD candidate at Deakin University in Victoria. So her presentation today is titled Moving Knowledge to Action, the Need for Knowledge Translation in Public Health. So Simone, whenever you're ready.
Thank you, Hilary. I'll just share that. All right, so good morning. I'm Simone McCarthy, and my presentation is titled Moving Knowledge to Action, the Need for Knowledge Translation in Public Health. I'm a PhD student at Deakin University and work in the Gambling Harm Prevention Unit, undertaking research on the impact of gambling in our communities. So in this presentation, several of my examples are drawn from this research area. So knowledge translation is an interactive process involving exchanges between researchers who create new knowledge and those who can effectively use it. However, health research often fails to translate research findings into practice and policy. It is vital that researchers use knowledge translation to ensure that evidence-based knowledge informs decision-making. Through knowledge translation, the benefits of research are accelerated. The healthcare systems and health services are strengthened, and there's a greater potential for positive outcomes for our population. Central to all knowledge translation strategies is the need to consider stakeholders who benefit most and can utilise knowledge. Knowledge translation must therefore become an integral part of research, where researchers value an integrated approach with policymakers and key stakeholders. This requires effective communication between those producing the knowledge and those implementing evidence-based practice and policy. Within gambling research, we are currently working closely with local councils to minimise gambling harm. The councils have been involved from the beginning, including project design, constructing interview questions, and final knowledge translation workshops that aim to understand how our research findings can be applied in the local context. Knowledge translation frameworks emphasise the critical need for stakeholder engagement at all stages of research to co-produce evidence that shapes and ultimately informs policy and practice. This enables researchers and key stakeholders to exchange knowledge and ideas and ensures that timely research is conducted that is relevant to the community. Involving key decision makers in the research process means that findings are relevant and can lead to evidence-based policy change. However, it is important to recognise that co-producing research may not always be appropriate. For example, researchers should not collaborate and co-produce research with industries such as tobacco, alcohol and gambling. Previous research indicates that their involvement has been used to create doubt and divert attention from product harm and can create favourable policy environments for these industries to maximise their profits. Instead, future research should employ strategies to develop independent evidence that enhances collaboration with stakeholders without conflicts to bridge this gap between research and action. Effective knowledge translation for public health researchers involves tailoring and synthesising key messages for different users, such as the public, practitioners and policymakers in language that can be easily understood. Further, methods of dissemination should be modified to better reach those who would most benefit from the research. This means moving beyond traditional routes of dissemination, such as peer-reviewed journals, to using multiple communication channels, such as active communication with the media and workshops and seminars with key stakeholders. An example of knowledge translation used effectively to inform policy change was from the recent ban of gambling advertising during live sport. Following research that found advertising a key influential factor of young people's intentions to gamble, a variety of messages were constructed to reach different audiences. These were disseminated via publication in a peer-reviewed journal, as well as through various media outlets and in a school-based newspaper article that targeted young people in Australia. These messages were further used in government advertising campaigns to advocate against gambling advertising. The success of this knowledge translation is evident as it sparked a discussion about gambling advertising, which gathered support from key influential stakeholders, including politicians. Community support for regulation led to an initial ban of gambling advertising near schools, roads and public transport by the Victorian government, with Premier Daniel Andrews citing the research findings as the critical reasons for this policy change. With continued community and political support for regulation, this led to the introduction of a national ban of all gambling advertising during live sport. This is one example of the power of effective knowledge translation. However, there are considerable barriers to implementing knowledge translation into research practices. For example, time and resources are needed to involve a range of stakeholders into research, and there is often little incentive for researchers to dedicate their time. For example, while the greatest impacts to society from research are studies that contribute to changes in practice and policy, these do not necessarily contribute to academic metrics. With universities fixated on grant funding, publications, and citation outputs, communicating research findings with media, communities, and organisations that impact policy and practice is often not recognised in academic promotion. Therefore, we must challenge the universities to include metrics that acknowledges these contributions to policy and practice to further encourage researchers to engage in knowledge translation. Leaders in public health should advocate for knowledge translation as part of the research process. Methods of knowledge translation should be built into the research plan from the outset, including involvement of stakeholders throughout the research project. Funding bodies also play a critical role in encouraging knowledge translation and should ensure that this is a priority in the research that they fund. This will be vital in a comprehensive strategy to ensure that research contributes to positive outcomes in public health. There is a role for public health leaders to implement strategies that address these gaps within their own work. Collectively, efforts need to be made to put scientific knowledge into action and ensure widespread implementation of evidence-based programs, practices, and policies. This must start with us, and it must start right now. Thank you.
Thanks, Simone. That was great. And we'll give our judges a chance for some questions now.
I'm happy to go first. Thanks, Hilary. Simone, thank you for that very thoughtful presentation. My question to you is, how do you wrestle with the financial influence of the gambling industry, given that the primary vehicle for controlling or minimising the adverse effect of the gambling industry is the same government that receives a substantial proportion of its revenue from that industry? How do you tackle that nexus?
Yeah, no, I think that's a really good point you're making, and it's definitely a challenge for everyone working in gambling. I think we do need to show that we're in support of not having these industries, having influence by funding, and we need to get funding from elsewhere. Yeah, we just need to show that we're not willing to work with the gambling industry and show governments that, like, community support for governments not taking revenue from gambling products.
Thank you.
Paul or Amy, did you have anything to add there?
Really interesting presentation. Are there any examples that we can learn of from countries that are doing this well?
Not that I can't really answer that right now, but I know there's definitely other industries that are doing this really well. And I was thinking about disability. They do such great work at incorporating all people with disability in their research, and they make sure that they're a part of the research and disseminating to people with different disabilities so they can understand the research and they can use the research. So there's definitely evidence from other industries, and I'm sure there's different countries that have better translation processes. But yeah, we can definitely learn from other people. Yeah.
Yeah, Paul, thank you. That was the question I had as well.
Wonderful. Well, thank you very much, Simone, for that. And we will move on now.
There was two very strong, I think the two strongest candidates were both PhD candidates, and they both presented very, very well, and it was a very close call between the two of them. But I think the judging panel has been unanimous in awarding Rosemary the prize. Simone, you should understand that you came a very close second, so you both should be congratulated. All four of you should be congratulated. You've done an extraordinarily good job, and I look forward to seeing all of you. In fact, I look forward to seeing all 45 of the applicants continue to be involved in public health and take up that mantle as future leaders.